This is In the Loop. I'm Christian Bryant. It's sort of cliche to be like, we've got a lot for you this evening because there's a lot to talk about every evening, but it's been a busy news day and we really do have a lot to cover, so let's get to it. A new study gives us more information on COVID long haulers and how many of them suffer from multiple brain related issues long after the coronavirus can't be detected in their bodies. Plus, there have been several mass shootings in the last 2 weeks. We'll hear from an expert on the psychological impacts of these events after a brief pandemic reprieve. But first, here's what you need to know right now. Police in Boulder, Colorado say a 21-year-old man from Arvada is the suspected gunman in the shooting at a supermarket that killed 10 people, including the first police officer to respond to the scene. The gunman has been charged with 10 counts of murder. A motive has not yet been determined, and officials say the investigation will take at least another 4 days. Authorities have also released the names of the victims, who range in age from 20 to 65 years old. This is the 7th mass shooting in the US in the last 7 days, and the 7th mass killing in the US since the beginning of the year. On Tuesday afternoon, President Biden ordered flags to half-staff and called for stricter regulation on firearms. Communities across the country dealt with an increase in gun violence during the pandemic, but there were also fewer mass shootings. Later in the show, we'll hear from national reporter Dan Grossman, who talks with experts about the psychological impacts of these shootings, especially after the COVID lockdowns of 2020 made them more rare. The global vaccine rollout has not been equal, and that could be bad news for everyone. The US, for example, has already vaccinated a lot of its healthcare personnel, and President Biden says the US will have enough shots to vaccinate the whole population against COVID by May. Meanwhile, the entire continent of Africa has distributed only 2% of global COVID vaccinations so far. In countries like Kenya and Zimbabwe, frontline healthcare workers still haven't received shots, and they're falling ill and dying. This makes the first line of pandemic defense more vulnerable right now. And if the virus has time to spread in unvaccinated populations, the risk grows that it could mutate into something more threatening, even to anyone who's had a vaccine already. About 75% of COVID vaccines globally have gone to just 10 rich nations. And things are getting more complicated for AstraZeneca, whose vaccine rollout was paused in European countries last week over concerns of blood clotting. On Monday, a US trial found the AstraZeneca shot was safe and effective, but hours after that news, US health officials said the trial results had included outdated information and may have painted an incomplete picture of the vaccine's effectiveness. Health experts worry that all the back and forth isn't just bad for AstraZeneca, it could damage confidence in vaccines overall, right when countries have to reckon with new spikes in coronavirus cases. As of Tuesday, AstraZeneca has promised an update with the latest information within 48 hours. And voters in Israel are headed to the polls today for the 4th time in 2 years. Prime Minister Benjamin Netanyahu has been in office for a record 12 straight years and is seeking another term. The constant voting is partly because getting a solid majority coalition together has been difficult. Netanyahu has often been forced to run that coalition with rivals, which leads to gridlock and more elections to try and break that. For this cycle, Netanyahu campaigned on his efforts to organize a fast rollout with Pfizer's coronavirus vaccine in the country. But critics at home and abroad say his administration has been slow to extend that help to Palestinians in Gaza and the West Bank. Absentee voting is expected to be more popular than usual because of the pandemic. Tens of thousands of people in the US have lingering illness following a COVID-19 infection. Studies show post-COVID long haulers continue to have symptoms months after the onset of COVID-19, even after tests no longer detect virus in their body. A new study found that a vast majority of them suffer from multiple brain-related issues. Newsy's Lindsay Thies has more.
Patients like myself that called long haulers, we want to get better.
For COVID long haulers, the list of symptoms and the unknown of when they will end is overwhelming.
The fatigue has been huge, to where I would sleep up to 15 hours a day.
The mental is actually a little worse than the physical.
A new study shows COVID-19 long haulers could experience neurological symptoms that last at least 6 weeks. Researchers looked at 100 non-hospitalized patients with persistent symptoms across 21 states. 85% of patients reported having 4 or more brain-related symptoms, 70% of them women.
I found that even with simple things like having conversations with my kids, I'm forgetting words.
I'm sorry, I find it very difficult to describe what it actually feels like. But it's like, let's see. Well, here's an example. I have lost my train of thought.
The most common: brain fog, headache, numbness or tingling, loss or altered taste, loss of smell, dizziness, pain, and blurred vision. Dr. Igor Koralnik heads up the neuroinfectious disease program at Northwestern Medical. He says the data shows long-haul COVID will hurt the workplace as well.
We also asked patients if they miss work. And so about 48% of patients said that they missed more than 10 days of work.
There may be some hope for long haulers in the COVID vaccines.
Never occurred to any of us that people would actually feel better.
In a survey of 650 Survivor Corps long haulers, 40% said their long-term COVID symptoms improved after getting the vaccine. More research still needs to be done, but experts think what might be happening is that long haulers have an immune response that COVID is throwing out of whack. And then by getting a COVID-19 shot, it sort of resets their immune system so it begins to behave normally again. In San Francisco, I'm Lindsay Thies for Newsy.
I tend to read Krispy Kreme's hot now sign like a notification and also a status update on how my body feels when I smell donuts. I can't be the only one. Want to get somebody to do something? Just say there's free food. That's partially what's brought me in the office every weekday for almost the last year. Here's what's trending. If you somehow needed more motivation to get your COVID-19 vaccine, Krispy Kreme has you covered. The donut company is offering free donuts for a year to anyone who gets a COVID-19 vaccine. Showing up at a Krispy Kreme location with a vaccination card will net you one free donut a day for the rest of the year. If you're not planning on getting vaccinated, you can also get free donuts too for some reason. I don't quite understand that. The restaurant says that the promotion will be open to anyone who elects not to get a vaccine, but only on Mondays and only through May 24th. Donut charity is kind of Krispy Kreme's thing. The chain told Reuters it gave away over 30 million donuts in 2020. We're not complaining.
Massive influence of communist money through Venezuela, Cuba, and likely China.
Sidney Powell, the lawyer who floated baseless election fraud claims as a part of former President Donald Trump's legal team, is backing away from her story in court. Powell is currently embroiled in a defamation lawsuit with Dominion Voting Systems, which argues she slandered the company with her accusations. Powell's lawyers claim she was just describing Trump's case against Dominion and argue no reasonable person would take her accusations seriously. The "don't take me seriously" defense has deflected similar defamation suits in the past. It might be tougher in this case though, since Powell kept repeating her claims long after the Trump campaign booted her off its legal team. The Chicago suburb of Evanston just became the first city in the US to roll out a reparations program for Black residents.
On a 8-1 vote, the Evanston City Council approved adoption of Resolution 37-R-27, authorizing the implementation of the Evanston Local Reparations Restored Housing Program and Program Budget.
Evanston City Council members voted to make $400,000 available to address the harm done by the city's discriminatory housing practices. It's part of a larger $10 million pool of money set aside by the city for reparations. There are a lot of strings attached to this plan though. It's designed to prioritize the descendants of people who lived in Evanston from 1916 to 1969, and the money's only being given out in $25,000 home ownership grants, which means only 16 families will benefit for now. Still, local movement on the issue could help spur more progress on a national level. A bill to start a formal committee on reparations has been dormant in Congress since 2019. Communities in Chicago, Atlanta, and Boulder, Colorado, and other cities have experienced mass shootings just within the last few weeks. While a lot of communities suffered from increases in gun violence throughout the pandemic, it seems like these mass casualty events weren't happening as frequently while we were locked down. National reporter Dan Grossman spoke with an expert about the psychological impacts of these recurring events.
First Atlanta, now Boulder. In less than a week, nearly 20 people have died at the hands of an active shooter in a public setting. For some, it can feel even more traumatizing this time around, as these were the first shootings of their kind in more than a year. As the sun rose, the horizon in Boulder, Colorado was shrouded in grief.
Seen in front of the King Soopers.
As scenes of old play anew.
It was just like fireworks were going off.
Black vest, short sleeved shirt.
I sort of was numb in that moment. I sort of just couldn't believe it was happening.
Seth Howard saw it with his eyes, but felt something.
We asked that question, how long?
Something Pastor Randy Spalding and so many of us have been wondering for quite some time.
I ask those questions like all of us do. I ask it in my particular faith perspective, but it's the same thing. Everybody's asking again, how long?
Boulder and Atlanta are the first shootings of their kind since the pandemic started. The caution tape, images of sorrow, they're uncomfortably familiar, yet might feel different after months without mass violence during the pandemic.
We can have a sense of normalcy, and then we're reminded normalcy includes tragedies.
Elizabeth Sather is a licensed clinical psychologist who deals with law enforcement after tragedies such as these. She says re-experiencing traumas, even for us at home, can be harder because it's combined with the trauma of the pandemic.
They will compound, and so the symptoms like depression, sadness, sleeplessness, trouble with your appetite, tendency to isolate, all those are multiplied. So the symptoms will be generally more intense and they will occur much more frequently.
It was just a night of really not knowing what was going on right across the street, right in my own neighborhood.
For Seth, he experienced that new reality Tuesday.
Just walking my dog in the morning, it's just not the same anymore. It sort of feels like it's been invaded in a way.
It's always difficult.
As did Randy.
These are people that I knew.
Knowing also the only way to a new horizon, a better one, will be by coming together as one.
We'll cry together, we'll weep and we'll grieve, but we won't be alone.
I'm Dan Grossman reporting.
The Biden administration is releasing some asylum seekers at the southern border without a court date while migrant processing facilities reach their capacity. At this point, health experts could be forgiven for getting blue in the face while warning us about another wave of COVID infections. And we need only look to Italy to see how that could play out. The country is in another lockdown because of the COVID variant first discovered in the UK and because of vaccine hesitancy. Folks are fatigued from this pandemic. Our partner on the ground spoke to Italians about their attitudes toward vaccines and how the government is handling this wave of infections.
Flags fly at half-mast as tighter lockdown rules are reintroduced. A year on from Italy's coronavirus outbreak is being marked while a third wave of infections rises. But the Italian lockdown in 2021 has a more relaxed feel to that of 2020.
Like they feel less the emergency right now. I don't think that right now, after 1 year, I need to stay at home because government don't know how to rule the thing, don't know how to deal with this pandemic anymore.
The population's increasing resistance to regulations and their decreasing perception of risk are key reasons for Italy plunging into a third wave of COVID-19.
Restriction measures are very hard to follow for a long period of time, and Italy in particular has been under lockdown on and off for nearly a year. So people are tired, they're frustrated, and because of the delays that there have been in implementing the vaccination campaign, this actually makes the situation even more complicated.
The European vaccination campaign has been moving at a slower pace than other countries, such as the UK or the USA. In Italy, the government hopes to start vaccinating those under 70 by the beginning of April. But a recent national poll suggested that nearly 20% of the population doesn't want to be vaccinated at all. Gianni, an 81 years old resident of Rome, believes he does not need to get the vaccine.
I haven't been sick, not even a day. since 1960. Not even a sore throat. Doing the vaccine doesn't seem necessary to me.
Non necessario.
In mid-March, Italy, along with other European countries, stopped administering the AstraZeneca jab, with the European Medicine Agency recently clearing all doubts around its side effects. Vaccinations restarted all over the country. However, thousands of people still refused the AstraZeneca vaccine out of fear. Outside one of the vaccination centers in Rome, people spontaneously gathered hoping to get the spare jab that had been destined for someone else.
Many people didn't come because they're worried, so I tried.
The government is planning a full national lockdown over Easter. In the meantime, some people have been told to wait for their turn, while those who reject the AstraZeneca vaccine face being pushed to the back of the line. Flavia Cappellini in Rome for Newsy.
The Biden administration is trying to figure out how best to address the influx of migrants at the U.S. southern border. So far, Customs and Border Protection encounters are outpacing numbers from last year, but the data doesn't really convey what it's like on the ground for people seeking asylum. Newsy's James Packard and Ben Chamiso have spoken to migrants in South Texas about their confusing next steps.
The first images from inside a Border Patrol facility in Donna, Texas, housing a flood of young migrants, some longer than the law allows. Kids in holding areas sectioned off by plastic dividers.
We are working around the clock to move those children out of the Border Patrol facilities into the care and custody of the Department of Health and Human Services that shelters them.
Overflow facilities elsewhere in the state with their own problems. At a Midland shelter, the state's environmental agency says the water isn't safe to drink. Over the weekend, the administration paying some $87 million for more than 1,200 hotel beds as shelters overflow. The administration so desperate to alleviate the strain, they're beginning to release migrants without court dates.
No me dio ninguna información.
At a bus station in Brownsville, this woman from Honduras told us the government said they would call her with that information and let her go.
Solo me dijeron que me iba a llamar algún juez o algo para presentarme.
She wasn't alone. This woman, who we aren't identifying to protect her safety, was desperate to get to the U.S.
No podía dar más dinero ya. Y yo no pude denunciar porque me decían que mataban mi familia, mis hijos y a mí.
Just two of the many migrants now coming to this station daily. So when migrants are released from a processing center, they end up here at a bus station like this one to go somewhere else. When they show up, they head over here, as these people are, to get a COVID test. The city is running those, and then if they test negative, they can wait in this area. There's another area in the back for people who test positive. There's a meal pickup here, and there's a nonprofit giving people clothes and snacks and diapers for the road.
They're just rushing in as soon as they can, unless the gates close behind them.
Many migrants say they're here because of new policies.
Cuando estaba en el mandato de Trump, imposible cruzar. Y entonces ahora con el de Biden, ahí sí.
While federal officials insist otherwise.
The border is closed.
The Biden administration is letting more asylum seekers stay on American soil, with the country on track to see more crossings than it's seen in decades. James Packard, Newsy, McAllen, Texas.
If you haven't done so already, feel free to reach out to us on Twitter using the hashtag NewsyInTheLoop. It's National Puppy Day. Not grown-ass dog you still treat like a puppy day. National Puppy Day. So go ahead and send me pics of your actual puppers when you get the chance. Restaurants and bars have struggled during the pandemic, and I have struggled to cook and mix drinks for myself, but we're not going to talk about that. National reporter Alexa Liaco tells us about one bartender's idea that will hopefully make this year one of his best.
Beer, the other great equalizer. Well, that's at least what Chris Bettini knows to be true.
You belly up to the bar, the person to the right of you could be making 10 times more money than you make, and the person to the right could be making 10 times less. But for the price of a beer, you're kind of equal for the next 30 minutes.
He observed this for years working behind the bar, but it wasn't until he started his own travel company that he lived it.
My tours kind of came about out of an unknown love to travel. I didn't have my first passport until 2008.
But after a few trips to Germany and brewing his own beer with European brewmasters, he had an idea.
Why just take a normal vacation if you can take a beercation? I'm in my full lederhosen at a festival, my hat's on, 2 big beer mugs, and you can tell I'm having a great time.
He became a one-man tour company and started Pub Culture Beercations.
It's kind of a way to explore the world one pint at a time, and to do it in a way where you kind of get in with the locals. You get to see more than your normal flashy, fancy tourist sites.
2020 was going to be the first year the bartender turned business owner made a profit.
Everything changed. Within 24 hours, everything changed.
COVID-19 stopped his wanderlust in its tracks. Travelers and tour guides alike soon found undoing weeks of elaborate planning was no easy task from thousands of miles away.
The hotels had no staff. I would email, but there was nobody to reply back.
Hotels refused to give Chris refunds, which made it hard to pay back his customers.
I did look into cashing in my 401k for extra money to help pay for some of that.
He worked for months to keep his word.
Just being a good tour person will eventually help me to provide more tours and more memories.
Today, Chris has travelers waiting at home, passports at the ready.
Now we're still looking at 18 months, maybe 2 years later, and we're not 100% sure what'll happen.
But he believes when it's safe, Beercations will be back.
I hope people are ready to just say, yeah, I'm no longer putting off 5 years to take that trip I've always wanted to take. I think that once the world is ready to travel again, people are going to want to travel again.
There's a German word Chris learned that describes just what his travels mean.
In German, they say Gemütlichkeit, loosely translates into the cozy feeling of belonging.
And once you've tasted that feeling, often packed in a pint-sized ice-cold beer, Chris believes you'll never be able to forget it.
Because we're sitting around and having a beer and enjoying ourselves, the world just keeps getting smaller. And I think that if we can approach the world that way, to make it a smaller place, it maybe ends up also in the long run becoming a little bit more of a place where we all get along.
In Omaha, Nebraska, I'm Alexa Liaco.
That's it for us, gang. As always, thanks for watching. We'll be back for more In the Loop tomorrow, same time, same place. Top stories from Newsy are headed your way right now.